His hands were shaking more than mine, which, considering I was the one holding the needle, was saying something. It was a late Tuesday, the kind of late where the city outside the window has gone quiet but hasn't quite gone to sleep, and you can hear the hum of the refrigerator like it's the loudest thing in the world. I was doing a house call for a friend of a friend. His name was Daniel. He was 30-something, broad-shouldered, the kind of man who looks like he opens jars without thinking about it. And he was sitting on the edge of his kitchen table like a kid, waiting for the school nurse, knuckles white around the edge of the counter. "I just want you to know," he said very seriously, "that I am not afraid of needles." I set my bag down on his kitchen counter. "Of course not. I just don't like them." "That's a very reasonable distinction." He laughed a little at that, just a small, surprised sound, and I could feel some of the tension in the room shift. That's the thing nobody tells you about being the person with the syringe. Half the job happens before you even open the packaging. Half the job is just the way you move through someone's kitchen at midnight, calm like you've done this 1,000 times. Because you have. And because calm is contagious if you let it be. He'd been sick for 4 days, a nasty respiratory thing, the kind that leaves you wrung out and aching in places you forgot you had. His regular doctor had called in a prescription, an intramuscular injection, B12 complex plus a metabolic support formula. And his friend, who knew me from a training course we'd both taken, had texted asking if I could help. His friend said Daniel had been trying to give himself the injection for an hour and had gotten exactly nowhere. I washed my hands at his sink. He had one of those kitchens that tells you things about a person. A coffee grinder, a single good knife, a plant that was either thriving or dying, and it was hard to tell which. I dried my hands on a paper towel and pulled on my gloves. "Okay," I said. "Which side do you want?" He blinked. "There's a choice?" "There's always a choice. It's your body." He thought about this with more gravity than the question probably deserved. "Left." "Left it is." I asked him to stand up and shift his weight to his right leg, just slightly, just enough to let the left hip relax. This is the part that matters more than most people realize. When a muscle is bearing weight, it's contracted, tense. You don't want to push a needle into a tense muscle. It hurts more, it absorbs unevenly, and the patient remembers it. When the muscle is at rest, everything is softer, more forgiving. The medication moves the way it's supposed to. "Can you feel the difference?" I asked him, "between standing on it and letting it hang?" He shifted, testing it. "Yeah, actually." "Good, hold that." The injection site I was looking for is called the ventrogluteal site. And I know that sounds like something from a textbook, which it is, but stay with me because this is the part that actually matters. You find the greater trochanter with your palm. That's the bony point on the outer hip. You can't miss it. And then you move slightly forward and upward into the soft triangle of muscle there. It's away from the major nerves, away from the large blood vessels. It's the safest site for an intramuscular injection in an adult, and it's the one I reach for when I have a choice. I pressed gently with 2 fingers, feeling the muscle beneath. He had good tissue. Not that I said that out loud, because some things you keep to yourself when you're trying not to make a situation strange. "You're going to feel pressure first," I said. "Then a pinch, then it's done." "How long does the pinch last?" "Less than you're expecting." I swabbed the site with an alcohol wipe and let it dry for a few seconds. People always skip this step, or they don't wait long enough, and the alcohol stings more than the needle when it's still wet. I pulled the cap from the syringe. The needle was 23 gauge, 1.5 inches long, appropriate for the depth of the muscle, appropriate for the medication viscosity. "Take a slow breath in," I said. He did. "And out." And on the exhale, because that's when the body opens, just slightly, just enough, I inserted the needle at a 90-degree angle, smooth, deliberate, not fast and not slow, the way you'd press a key into a lock you've opened 100 times. I aspirated briefly, drew back the plunger just a hair to check there was no blood return, which would tell me I'd hit a vessel instead of muscle. Clear. Good. Then I depressed the plunger slowly. This part you don't rush. A thick oil-based solution pushed too fast causes pressure pain that patients remember for days. Slow and steady, the medication disperses into the muscle tissue, and the body accepts it without complaint. He was quiet the whole time. Not tense quiet, just still. The kind of still that happens when someone has decided to trust you and is honoring that decision. I withdrew the needle in one clean motion, pressed a small piece of gauze to the site, and held it there for a moment. "That's it," I said. He turned his head to look at me. There was something almost offended in his expression, like he'd been bracing for something that never arrived. "That's it?" "That's it." I was sitting here for an hour. "I know." "An hour," he repeated, like the word had a different weight now. I capped the needle safely. Always recap with one hand, never reach for the cap with your fingers, and dropped it into the small sharps container I carry in my bag. Some people skip this too, and it's the kind of skip that ends badly. Used needles go in a proper container. That's not negotiable. He sat back down on the edge of the table, and I pulled off my gloves and washed my hands again. He poured me a glass of water without asking, which I thought was a nice thing to do. "You should keep an eye on the site for the next hour or so," I told him, leaning against the counter. "A little soreness is normal. If you see redness spreading or it feels warm to the touch past tomorrow morning, call your doctor, not because it's likely, but because it's worth knowing." He nodded, holding his water glass with both hands. "Also," I said, "since you've had a fever this week, have you been keeping track of it?" He made a face that told me the answer was no. "Fever is useful information," I said. "Not just the number, the pattern. A fever that spikes at night and drops in the morning tells a different story than one that stays flat all day. If you can, check it at the same times, morning, afternoon, evening, and write it down, even just on your phone. It helps your doctor actually understand what your body's been doing." He looked at me like this was genuinely new information, which, honestly, it usually is. We treat fever like a single event. It's high, it's gone, it's back, when really it's a conversation your body is having, and the pattern is the language. "I'll do that," he said, and I believed him. I packed my bag. He walked me to the door, slowly, the way people move when they've been sick and the body is still negotiating with itself. The hallway outside his apartment smelled like old wood and someone's cooking from 3 floors up, something with garlic and something sweet underneath it. "Thank you," he said at the door. He said it simply, without the performance of gratitude, just the word held out like something he meant. I smiled, pulled my coat on. "Rest," I said. "Actual rest. Not the kind where you lie down and check your phone every 4 minutes." He laughed again, that same small, surprised sound. I walked down the hallway and I didn't look back, and the elevator was slow and warm and smelled faintly of someone's perfume from earlier in the evening. I stood in it with my bag and my gloves folded in my pocket and thought about how strange and quiet and good it is, this thing, this work, to be the person someone lets close enough to help. There's a kind of trust that doesn't have a name for it. It lives in the moment just